You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, orthodontics for children and teenagers. With us, we have an expert on the topic, board-certified orthodontist, Dr. Anne-Marie Gorczyca. Dr. Gorczyca, welcome back to the program.
Thank you, Randy. I'm so happy to be here.
Now, for people that don't know your practice, and I know you brought a lot of photos, so we'll make sure we get to those, but tell us a little bit about your practice. Who's your typical patient, and what are the different services you offer? I mean, it's mostly orthodontics, I guess all you do.
That is correct. Our office is located in Antioch, California, which is about an hour and a half north of San Francisco. And we offer a broad range of orthodontic services, starting with patients as young as 4 years old, the whole way up to 84 years old.
So 84 is the oldest patient. And is it safe at 84 to move teeth?
It certainly is. And for certain conditions where tooth crowding is causing periodontal issues, 84-year-olds are coming in for orthodontic treatment. So it's never too late to get a beautiful smile.
Now you have fun in your practice
Oh,
because
we
I'm a
sure do.
Facebook friend of yours and it looks like a fun place.
Thank you.
You involve the patients.
Well, we try to make each day fun, and we have three goals at Gorczyca Orthodontics. One is clinical excellence, the second is outstanding customer service, and the third is a great patient experience. And we work hard to make our patients have a good time and feel good about their orthodontic treatment and look forward to coming back for their next appointment.
Great. Now on this program today, is your hope that parents will see this and this will let them know their options? Or let them know the importance of having straight teeth growing up?
Well, my goal today is for parents to know that the American Association of Orthodontists and all orthodontists recommend that every child receive an orthodontic evaluation by age 7.
Okay.
Many orthodontic issues are already apparent at age 7. Let me give you an example. This first patient, who is 7 years old, has an anterior crossbite and a posterior crossbite. You can see that when she bites on the left side, her upper teeth are inside the lower teeth. And that is shifting her jaw to the side. She has a functional shift from her upper jaw being too narrow. That can be corrected easily with orthodontic treatment using some upper arch expansion methods. And as you can see in her final result, her crossbites are gone, her midlines are aligned, she has a beautiful smile, but more importantly, her face is symmetrical. And this will ensure that she has ideal growth and development in the future in a symmetrical pattern.
Now this little girl looks like 7 or 8 years old?
She is 7 years old.
But her permanent teeth aren't in yet.
Right. At age 7, patients typically have 12 permanent teeth and 12 baby teeth. We call this period the mixed dentition. And the type of orthodontic treatment that we do at this time is called phase 1 orthodontic treatment. It doesn't mean they won't have orthodontic treatment in the future. Basically, it is a treatment of severe problems, and it's like doing half of the treatment now in phase 1 and half of the treatment later in phase 2. So it's a phase 1, phase 2 program.
By doing it early, like if parents are watching this, what's the number one reason why it was a great idea, other than aesthetics, why was it a great idea that this parent brought her in and you did this?
Growth and development, that you are creating an environment where the patient can have symmetrical and a healthy growth pattern, but also you're creating room for the permanent teeth, which will all be erupting into position by age 12.
So it'll give her a big, broader smile? She'll grow
Yes.
into a bigger, broader smile?
Yes.
Less tooth extraction, possibly?
That is correct. Definitely less tooth extraction. If you want to prevent teeth from being extracted in the future, it is critical that you bring your child to have an orthodontic examination by age 7, and that you consider phase 1 orthodontic treatment for arch expansion.
Now, many parents wait until their kids are 16 or in high school. Why is this not a good idea?
Many things can be prevented at an early age. And many things can be treated at an early age that will be much more difficult to treat later on, or perhaps even impossible to treat later on.
Now, we've talked off camera. I mean, it's better to have your high school years out of braces.
Definitely.
So if you get it done early,
yeah, you'll be done by 10th grade, for sure. And then junior prom, graduation, you have no worries, you have a beautiful smile, and you can enjoy smiling at those events and not be thinking about your braces or orthodontic treatment. Let me show you another case.
Okay.
Parents may ask, how early can I bring in my child for orthodontic treatment? Here's a little boy. He is 5 years old, and he is with the baby teeth. But in the baby teeth, he already has signs of severe malocclusion, including a posterior crossbite and front tooth crowding. And we know that the permanent teeth are going to be so much bigger than the baby teeth, that this is a serious, serious problem that really warrants treatment at age 5. So we made a little expander for him at age 5, and we did phase 1 orthodontic treatment.
When does he wear that? Is that like a retainer?
It's like a retainer.
Or he wears it daily?
That he would wear daily and nightly, 24 hours a day, 7 days a week. And slowly we are able to expand that upper arch. The benefits are not only dental. The nasal passages are also expanded. The patient can breathe better. The patient can sleep better. There'll be less snoring, and there'll be better sleep pattern. And this also, we know, improves children's performance at school. So it's all tied into your general health and wellness that you receive early orthodontic treatment for severe cases like this one.
So if you visually see a problem with your children's teeth,
if you
like
see
this,
a shift, or that your child is having difficulty chewing at their 4-year-old birthday party, you should bring that 4-year-old in to see an orthodontist. And the final result in this case is at age 12, after the patient has completed phase 2 orthodontic treatment, and he's done in 7th or 8th grade, and he's ready for high school. And he's a confident young man looking forward to his fun high school days.
So that's the goal. If you get them in early, they could completely
be done before high school.
That's nice.
Here's another case, that's something that we see commonly in young children. This young girl is saying, all I want for Christmas are my 2 front teeth. And she only has 1 front tooth. And there are several reasons that could have occurred. The most common reason is losing a baby tooth too early. When a young child falls, hits their tooth on a counter, knocks out a baby tooth, what happens is the bone and tissue grows back over that permanent tooth before it's ready to come into the mouth. Mm-hmm. When it's time for that tooth to come in, sometimes it becomes too difficult for that tooth to cut its way through the gum. And teeth like this need a little help. They need a little releasing incision made by either their pediatric dentist, periodontist, or general dentist to allow that tooth to come into position. That's the most common cause. Another common cause is an extra tooth. And an extra tooth between the 2 front teeth is called a mesiodens. It's very common in the Hispanic population and also in the Indian population of patients from India.
That's where you have like 2 teeth,
you have an extra tooth right
like behind?
in the middle, right in the middle of your 2 front teeth. It's called a mesiodens, a tooth in the middle. And that tooth needs to be removed. Often the front teeth may need a little help being pulled into position for a healthy smile in phase 1 orthodontic treatment in children 7 to 9 years old.
So that's her after.
Yes, and that is phase 1 orthodontic treatment. The after result shows 12 permanent teeth and 12 baby teeth. And she's lost a few baby teeth there, so maybe 8 baby teeth. And we will now be waiting until she's 11 and a half to lose those baby teeth so we can start phase 2 orthodontic treatment at that time.
What is the hardest thing or hardest message to get across to parents about early treatment?
The hardest message is, and we're going to get to this, Randy, that you may not see or recognize a severe problem, such as a crossbite. An orthodontist is going to look at every tooth in the mouth and look at the closing pattern to see if some growth and development abnormalities exist that need to be corrected. So orthodontics is not just about tooth alignment. It's also about the proper positioning and relationship of the upper jaw to the lower jaw.
What about the pediatric dentist? What is their role here? And what if the pediatric dentist said you're fine? Should you, what are your thoughts? And what are your recommendations to parents?
Orthodontists are vastly experienced at orthodontic treatment. So the only way you're going to get all the information that is out there for a thorough diagnosis and treatment plan of all orthodontic concerns is with an orthodontist.
All right. Okay, now you have more photos.
Okay, another common problem in young children is thumb sucking. And thumb sucking beyond age 6, when the permanent teeth are coming into position, can cause serious problems. In this situation, we have an open bite. And one of the...
So thumb sucking just pushes the upper and the lower out?
It prevents the teeth from coming into position.
And they flare out?
They flare out and they stay open because you have a barrier for tooth eruption. And the tooth cannot come into the position that it was meant to come into. Another side effect of open bite from finger sucking or thumb sucking is a tongue thrust. And with an open bite, there is a tongue thrust because I can give you this exercise. Randy, if you take your 2 fingers and put them between your teeth.
Yeah.
And try to swallow. You can't.
It's hard.
You have to push your tongue forward. You cannot swallow without creating a seal of your lips over your teeth. And often children create the seal with their tongue, which exacerbates the problem.
So it starts with thumb sucking, and then their tongue adds to the problem and pushes the teeth.
That's correct.
Interesting.
But once the habit appliance is placed, once the teeth are corrected and they're in the right position, the tongue thrust should go away. Now, let's look at a case after phase 1 orthodontic treatment. Here's a typical case of a girl. She's 11 years old, and all her permanent teeth have come in. And you can see that her front teeth are perfectly straight, but other teeth have come in on the side that are a little bit crooked. And this is the typical presentation of someone who is getting ready to do phase 2 orthodontic treatment. Okay. What's important here is that this now is a very easy case to treat in a relatively short period of time. So the investment that you have made in your phase 1 orthodontic treatment is rewarded in your phase 2 orthodontic treatment, that now you basically have an alignment scenario where you'll be aligning teeth quickly and you'll finish your treatment quickly and be done with your orthodontic treatment in a reasonable period of time.
Now, for people just tuning in, we're talking about phase 1 is when your child is about 7 years old. And if you do that early, are they out of braces faster when they're, 11 years old, 12 years old?
Yes. When you do a phase 1, phase 2 orthodontic treatment, the phase 2 treatment, which typically starts at age 11, 12, or 13, is much simpler and more efficiently done because the teeth are relatively straight. The major things have been corrected, and now we are straightening and aligning the teeth.
Okay.
Now, in contrast to phase 1, phase 2 orthodontic treatment, we have comprehensive orthodontic treatment at age 13. And when you do comprehensive treatment, you start with a more severe initial malocclusion. So here we have a crossbite on the right and the left, but the crossbite has also created crowding of the permanent teeth coming into position. So this beautiful young lady had upper arch expansion, and you can see the broadening of that upper arch from the beginning to the end, and how that has broadened her smile and given her more tooth showing and eliminated the black corridors in her smile in the side. Another common problem is tooth spacing. And this is often caused by thick gums and an attachment between the 2 front teeth called a frenum. That frenum is a thick piece of tissue which pushes the teeth apart and it spaces the teeth. If you look at that upper arch, you can see that thick frenum. So in a case like this, the orthodontist will close the space, but after the space is closed, a periodontist will need to remove that tissue and do a little bit of gingival recontouring.
So the gum in between those, in between the gap on the teeth, has to be taken care of?
It has to be taken care of to give you a beautiful smile and show the amount of tooth that you would like to show in that final result to have a gorgeous smile.
So if you are a parent and your child, 8 years old, 9 years old, 7 years old, has a gap in between their two front teeth, it's not going to get any better.
If
Is that
it's
right?
wider than 2 millimeters, which is not very wide,
If you could see through it.
if you can see it, chances are it will not close on its own. And if it's something that bothers you, bothers the
Is
child.
that a phase 1 or phase 2?
That
Do
could
they
be
wait?
phase 1 or it could be phase 2. It depends how the child feels about it. And ask the child, is that something that bothers you that you'd like treated now, or would you like to wait till you're 12?
Would you prefer to do it earlier rather than later?
I would always prefer to do it earlier because you have the gained satisfaction of having a beautiful smile for more years.
Nice.
And the children have more self-confidence at school. So here's another case. And this is the most typical orthodontic case. It is the overjet, overbite tooth protrusion case. And this case illustrates a deep bite where the two front teeth are missing each other in the vertical direction. The lower teeth are biting into the roof of the mouth. The teeth also stick out in the horizontal direction. And teeth should not be left like that because a good bite is more than 6 straight front permanent teeth. It is the correct bite, the correct meeting of the front teeth. We call this anterior tooth coupling for ideal occlusion. So in that final result, you see the overjet and the overbite is correct.
Yeah.
You can see the lower teeth, and the patient has good chewing pattern. They are able to chew well, and they also look gorgeous. Now, another typical bite is the underbite. And underbites are often caused by upper baby teeth being left in too long. The upper baby teeth are stuck in the bone and they don't come out. The permanent teeth come in behind them, and then it creates a long-term underbite. That is another case that should be treated early at age 7 to create that long-term problem.
So a child, I mean, if you see your kid with an underbite, you got to go in and get that done.
That is a serious thing that should be treated right away.
And it affects their appearance as well.
It affects your appearance, but it also affects the wear of your teeth. If you have a crossbite, you are going to wear down the enamel of that tooth as you constantly grind the tooth down over time. So it's very important to get a crossbite fixed as soon as possible.
Is headgear and things like that a thing of the past, or that still exists?
So glad you mentioned that, Randy. There are cases like this one, which are a skeletal discrepancy. The upper and the lower jaw do not meet properly. And it could be that the upper jaw sticks out too far. It could be that the upper jaw is too far back. This particular case, yes, the patient had a headgear. She had a reverse pull headgear with a palatal expansion. And there are things that can be done to modify growth. And one of them is to bring the upper arch forward. Another is to bring the upper arch back. But there are also many devices that are not removable and don't require any patient compliance that can also be used to move teeth back and help prevent a big overjet.
Okay, good.
Now, what do you see here? Do you see what I see? Here we have an orthodontic emergency, but it is totally not visible to the average parent, the average patient, or even the average dentist.
This is an emergency?
This is a severe emergency.
Really?
Because this 16-year-old has 4 impacted canines. And the teeth that you see there are primary canines, 4 of them, that should have been lost by age 12. Now, canines are the killers of tooth roots. They are such a powerful tooth, they can eat away the roots of other teeth as well as cause pain. So do you see what I see? No one will see what an orthodontist sees because orthodontists are trained to think of every possible situation why those primary teeth are still there. And they will recognize that those are primary teeth where the average dentist or the average parent or patient will not recognize that those are primary teeth.
Are you talking about baby teeth?
I'm talking about baby teeth.
Okay.
Yes. All baby teeth should be gone by age 12 on average. And when a baby tooth is maintained too long, it is an indication there is a problem. Here's the final x-ray, and you can see that we successfully brought those 4 canines into position, which is not an easy task, but an orthodontist can do that for you. And if you have this problem, you should get it taken care of as soon as possible. Age 12 would be ideal. By age 15, it's okay, but after age 21, It's very difficult, if not impossible. Now, another scenario is a missing tooth. Many people have missing lateral incisors. That's the most common missing tooth. And for that, the orthodontist will prepare the teeth so that you can get an implant. Now, implants usually are not placed in a growing child until 19 because we want the growth and development to be stopped. But you don't want to go through your high school years with large gaps between your teeth. So the orthodontist will prepare the teeth for implants. They'll also...
So this is on an 18-year-old or 19-year-old?
Or a younger patient who would like to have a false tooth placed in that space so that they don't have to go through high school with a missing tooth.
So if your child is missing 2 teeth, born without teeth,
right,
go to an orthodontist, bring it together.
As soon as
you don't
possible.
have to have dental implants in the future, possibly.
The canine teeth can be reshaped to look like laterals. And we can work very closely with your cosmetic dentist to make the first bicuspids look like canines so that no one will know.
So this is common. Is this common, by the way?
It is
very
common.
Rare?
The laterals are the most commonly missing tooth. Here's another example, a bombed out tooth in a young person. Look at this lower first molar. It is what we call bombed out. The tooth has had a crown, it may have had a root canal, and its prognosis is poor. And perhaps that tooth needs to be extracted. If you need orthodontic treatment, as this young lady needed for her protrusion of her teeth, the orthodontist can take out the most unhealthy tooth that you have and close the space orthodontically so that you may not need an implant in the future. And that's another thing to consider when considering...
Or a bridge or partial or whatever.
That is correct. And in young patients,
Interesting.
That is the treatment of choice in young patients.
I didn't know that. You were on my show before. You never told me that. So this is...
That's why I'm here.
So I'm learning things all the time
I'm spreading the good news of orthodontics.
This is good.
Now, one final message that I'd like every viewer to know is that orthodontists recommend that you have retention of your orthodontic result for life. And studies have found...
What does that mean? I don't know what you mean by that.
I mean retainers and I mean permanent retainers. And studies have shown that patients who maintain their retainer wear or have permanent retainers placed, a recent study just came out studying patients after 20 years who had permanent retainers, and 20 years later they had 0.06 millimeters of movement, which basically is imperceivable. So orthodontists are working very hard to make sure that your bite is maintained for life. And one of the ways we're doing that is by saying retainers for life, and come and see your orthodontist.
So a permanent retainer.
That is correct. It's non-removable. You see on that patient in the lower arch, a little tiny wire is in place.
Is this fairly new, by the way? Because I had lower braces, and when I had them off, I was offered a temporary retainer, and then my teeth shifted again.
Yeah.
But I was never offered a permanent retainer.
Permanent retainers are very popular, and in fact, we have been doing permanent retainers for years. Patients drive hours.
You can't see them.
You can't see them. The patients like them. The only side effect is flossing. You have to spend a little bit more time flossing, but it's a great retention device.
So you love it.
I love it, and I've been doing it for over 25 years. So one final message I'd like every viewer to know, and that is, what questions should you ask when you go to see your orthodontist, or choosing an orthodontist, or choosing your orthodontic care? One question to ask is, are you an orthodontist? If someone is doing crown bridges, veneers, they are not an orthodontist, and you should know that. For consumer awareness, you should know what an orthodontist is. The second thing you can ask is, are you a member of the American Association of Orthodontists? That is the organization of orthodontists. You can go online to www.mylifemysmile.org, and you can find an orthodontist in your area who is a member of the American Board of Orthodontics. The third question you can ask is, how many cases like mine have you treated? Your orthodontist should be able to show you before and after cases just like yours. And the final question I would ask is, how long have you been an orthodontist? Where did you get your training? Are you a graduate of a 2 or 3 year ADA accredited orthodontic residency program? Or are you not? Orthodontists are vastly experienced, and they will be able to handle all of your orthodontic needs. Some are visible, some are invisible. But it's important that they diagnose and treatment plan all of your orthodontic findings. So Randy, thank you for having me on the show and letting me share the message of good oral health.
Always a pleasure.
And
I mean, you always have a lot
orthodontics.
to say. And I think every time you're on the show, we all learn something.
And that's what I'm here for, because I am an orthodontic evangelist, and I want every patient to get the quality orthodontic care that they deserve.
And it doesn't cost more. That means with all things being equal, you might as well go to a specialist over somebody.
That's
Is that
correct.
your belief?
Because orthodontists are vastly experienced. It's a perspective. It's a perspective. The orthodontic specialty has now been around for 100 years. 100 years ago, a dentist did all procedures. They did oral surgery, they did periodontal treatment, they did orthodontics. But then the specialists came along, and there are 9 specialties in dentistry. And a specialist has a different perspective. It's like, is the earth round?
Yeah.
Okay? If you're just going around your block, you might think the earth is flat, but the earth is round. Because scientists have proven that you can sail around the earth and you will come back.
So are you implying that an orthodontist has such a broader view of what's possible?
It's a very broad view, and we are passionate about our profession. We're very experienced, and it's hard to describe how complicated orthodontics is, but it is not easy. It is a scientific study, and it is an artistic study, and it requires manual skill.
Okay.
It doesn't matter what bracket you use, what system you use, whether you have custom-made brackets or manually placed brackets. The quality of the result, which is the final product, is dependent on the skill of the orthodontist. And that's what patients are looking for. So I hope I've enlightened the public today about what questions to ask, what results to look for, and how to find an orthodontist at www.mylifemysmile.org.
All right, I want to thank you for coming on the show. Always a pleasure.
My pleasure,
Thanks
Randy.
again. You've been watching The Wellness Hour. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.